ஹாய் ஆல், வெல்கம் டு மை சேனல். இன்னைக்கு நம்ம சேனலில் என்ன பார்க்க போகிறோம் அப்படின்னா இம்பார்ட்டன்ட் கீ நோட்ஸ் ரிலேட்டட் டு ஓபிஜி நர்சிங். The genital organs are divided into internal and external genital organs. The external genital organs is otherwise called as vulva. The organs include mons pubis, labia majora, labia minora, and clitoris. The clitoris, it is measuring about 1.5 to 2 centimeter and it is situated in the most anterior part of the vulva. The internal genital organs are vagina, uterus, fallopian tube and the ovaries. When the fetus is having some genetic abnormalities, the three tests is necessary to identify the genetic abnormalities. The tests are amniocentesis, chorionic villus sampling and alpha fetoprotein. The amniocentesis procedures is not done before the completion of 15th to 16th weeks after the conception. The amniotic fluid level will reach us the maximum peak level minimum 1000 ml in 36 to 38 weeks of pregnancy. The specific gravity of amniotic fluid is 1.010. Amniotic fluid is alkaline in nature. Then amniotic fluid it's contain 98 to 99 percentage of water and 1 to 2 percentage of solid. The nitrogen paper test. This test is used to differentiate the amniotic fluid from the urine, fetal urine. When the paper turns into blue in color in case of amniotic fluid and yellow in case of urine. Then amniotic fluid, the main function is protection of the fetus inside the uterus. Funis is the other name of the umbilical cord. Umbilical cord, the other name is funis, Funis. There are two arteries, umbilical arteries and one umbilical vein present in the pregnancy. The oxygenated blood enters the fetal circulation from umbilical vein via ductus venosus. The closure of the umbilical arteries takes about 2 to 3 months after delivery. Then coming to pelvis. Absence of one ala of the sacrum is called nigillus pelvis. Absence of both sacral ala is called Robert pelvis. Gynecoid pelvis is the most suitable pelvic shape of childbirth. The shape of the gynecoid pelvis is round. Android pelvis is the least suited pelvis type for childbearing because the ischial spine is prominent in android pelvis. The shortest obstetrical conjugate diameter is anterior posterior diameter. The shortest anterior posterior diameter is obstetric conjugate. When the infant is having increased intracranial pressure, the signs is bulging fontanelles. Anterior fontanelle becomes ossified around 18 months after birth. Posterior fontanelle becomes ossified around 6 weeks after birth. Anterior fontanelle is diamond shaped. Posterior fontanelle is triangular shaped. There are three signs, pregnancy signs, that are presumptive signs, probable signs and positive signs. So what are the presumptive pregnancy signs? The first sign is amenorrhea, loss of regular periods, nausea and vomiting, increased size and increased feeling of fullness in breast, pronounced nipples, urinary frequency, quickening. What is quickening? The first perception of the fetal movement by the mother. It will occur 16th through 20th weeks of pregnancy. Then fatigue, discoloration of the vaginal mucosa. These are the presumptive signs of pregnancy. Then coming to probable pregnancy signs. It may first uterine enlargement. Three signs, mainly Hegar's signs, Goodell signs and Chadwick signs. Hegar's signs, it means Compressibility and softening of the lower uterine segment. It occurs about 6th week. Goodell sign, softening of the cervix that occurs at the beginning of the second month. Chadwick signs, violet discoloration of the mucous membrane of the cervix, vagina and vulva that occurs about 6th week. Then ballotment. The what is ballotment? The rebounding of the fetus against the examiner's fingers and palpation. That is called ballotment. Broxton Kicks contraction. What it means the contractions are irregular and painless. It will occur throughout the pregnancy. Intermittently it will happens. Then positive pregnancy test is detected by the HCG, means human chorionic gonadotropin hormone presence of in the urine. Then positive signs, it means diagnostic signs. What are the diagnostic tests to detect the pregnancy positive? First one is fetal heart rate detected. So the fetal heart rate is detected by electronically Doppler at 10 to 12 weeks by using fetoscope at 20th weeks of pregnancy. Then active fetal movements palpable by examiner. Then outline of the fetus via radiography and ultrasonography. So these are all the three pregnancy signs: as presumptive signs, probable signs and positive signs. Then what is GTPL score? GTPL score. G means gravity. T term births. P preterm births. A abortions or miscarriages. L current living child. This is GTPL score. Thank you. These are all the some important key points related to OBG nursing. If you like this channel, you can subscribe to me and ring the bell button. You will receive my notifications. Thank you.